In this case study, we look at a Division I softball athlete who tore her ACL, and we do a rehabilitation 12-week program. This presentation is brought to you by Juan Aquino, Jacob Ruecker, Noah Hendrickson, Paul Coyer, Michael Midlow, Tessa Pierce, and Kyle Whitman as part of the Clemson University Basketball Strength and Conditioning Internship.
So just a little background information on our athlete. She is a Division I softball player who recently went under surgery of having a right knee patellar tendon graft. Now, a patellar tendon graft is where the surgeon takes a strip down the middle of the patellar tendon and inserts that tendon into where the damaged ACL was. So our program goals for our athlete is going to be to develop quality, movement efficiency, and motor control through controlled isometrics and by taking them through a 1x20 program. We also want to redevelop maximal speed with our athlete, and so we're going to take them through our basic wall drills and progressions, which we'll get into later. We also want to induce hypertrophy to the athlete so we can work on the muscle cross-sectional area so that we can get the athlete back to the strength that they were at before the injury. We also want to redevelop the energy system, and we want to incorporate power, speed, and sport-specific skills again.
In this case study, the athlete is a softball pitcher. Our needs analysis looks into the complex series of movements and force generation that is required for the sport. A pitcher's stride foot can reach a peak vertical force equal to 179% of body weight. As ball velocity and momentum increase, the amount of force needed to stop is all transferred to the ground through the leg. Therefore, we must improve conditioning and increase bilateral strength. Not only do we want to return to pre-injured strength and limb side symmetry, we also want to look at the hamstring and quad strength ratio as well. Building strength in the lower body and not neglecting to train and improve upper body will be key.
Our program philosophy is based on 3 4-week blocks with individual goals for a 12-week period. The end goal, having the athlete be able to return to the same or as close as possible performance levels that they were pre-injury. We aren't solely focusing on the mindset of return to play, but the return to optimal performance. Block number 1, weeks 1 through 4, our focus and goals are starting with stressing the central nervous system with high volume motor patterning and control with resistance exercise. The high volume coming not necessarily from intensity, but from the amount of reps and exercises that we do during this block. Due to the neuroplasticity after the ACL injury, we want to develop neuromuscular adaptations for increased motor control reacclimatization to pre-injury levels. For the entirety of block number 1, each week will consist of a 1x20, one exercise for 20 reps. Our weekly goal will be to increase the rate of perceived exertion by increasing the resistance load. The resistance load will not increase significantly, but a gradual increase will prepare the athlete physically and mentally for return to play, and also prepare them for blocks 2 and 3. Block 2, weeks 5 through 8, will be the beginning of our modified triphasic training block, with the focus being on isometric and eccentric muscle actions. This will be done by manipulating the muscle action timing ratios that we use for each of our exercises. The first 2 weeks, our focus will be on isometric, and the second 2 weeks a focus on eccentric. The philosophy is to use specific muscle actions as well as an increase in the resistance load to develop joint and tendon integrity. There will be increased intensity and workload as we are now doing a 4-day split as opposed to a 2-day split from the previous block. We want to develop foundational strength and our newly acquired increases of ranges of motion. Overall, the program for this block will have a significant decrease in the reps from the previous block with an increase in the resistance load. It is very important that we establish correct muscle action timing for our specific focus for each of these 2 weeks. we want to make sure that we are actually doing an isometric and eccentric muscle actions for each of those weeks. Block number 3, weeks 9 through 12, will be our final preparation for the athlete's return to optimal performance. We're going to begin by finishing our third phase of the triphasic training program, focusing on concentric muscle action. Developing maximal strength is our primary goal for this block. The use of velocity-based training for optimization of power and speed will be implemented, with our first 2-week focus being on rate of force development, and our second 2 weeks focusing on reactive strength. The use of velocity-based training will allow us to see increases in explosive and reactive movements via increases in our exercise movement velocity numbers. Overall, the muscle actions will be the quickest compared to the previous block, and our most explosive and reactionary drills will be used. Our goal is to focus primarily on mimicking sport-specific movements to allow this athlete to be prepared physically and mentally for their return to optimal performance.
Starting off our athlete profile, we have the Nord board and the force plate. The Nord board. The hamstring quad strength ratio is one of the most important factors that we consider in our program. This device allows us to quickly and efficiently gauge our athlete's hamstring strength. The aim is to achieve at least 85% strength symmetry before returning the athlete back to play. The next device that we will implement is the force plate. Force plates will allow us to analyze the ground reaction force symmetry, and this data can be potentially useful in indirectly assessing knee kinetic symmetry. Stiffness index. It's important to look at the reactive strength index both bilaterally and individually for jumps and hops. When jumping with 2 legs, athletes can mask injuries and compensate any asymmetries. Isolating individual legs will expose any injuries. Eccentric RFD. Specifically measuring rate of force development is a bit cloudy. RFD is hard to evaluate because it's challenging to define when the intent of the movement begins. With counter movement jumps, we can better calculate eccentric RFD.
In collaboration with the athletic trainer, we will use the biodex to measure isokinetic strength in the injured leg of the athlete. Before returning to play, we want to see a greater than 90% isokinetic strength compared to the non-injured side in both the hamstrings and the quads.
The goal of any warm-up is to prepare the athlete mentally and physically for exercise. While the positive effects of including a warm-up are well known, can we utilize this warm-up time even more effectively? As a bit of background information, the sports medicine staff of the university have fully cleared the athlete and showed that the athlete demonstrates ranges of motion of that prior to injury. While the athlete may be able to demonstrate these ranges on the athletic training table, this does not necessarily mean they will use it during exercise. This is why we will be using the Dynamic Warm-Up Movement Assessment, DWMA for short, in our warm-up. During exercise, the athlete may be compensating for their injury in other locations along the kinetic chain. Using the DWMA allows us as coaches to identify these compensation patterns and structure our program in an effort to correct them. The movements we want to include in our warm-up series are those that allow us to identify limitations in knee flexion and knee extension. Each exercise in the series will be performed for 1 set and for a distance of about 15 yards. The first exercise performed is called the inchworm upward dog. As seen in the video on the left, the athlete will begin walking their hands out in front of them until they reach about shoulder level, and at this point they will transition into the upward dog position. After that, the athlete will then pike back up and walk their feet up towards their hands as seen in the video on the right. In our case, particular attention needs to be placed on the second portion of the movement. Is the athlete able to walk their feet up to their hands without pain while keeping their legs straight? If not, the athlete may be compensating for their injury at the ankle. The second movement in the warm-up series is the straight leg hip hinge. The athlete will reach one leg straight back while balancing on the other leg and reaching the floor in front of them. With this movement, we want to pay attention to the injured leg when it is the trailing leg and when it is the balancing leg. When the injured leg acts as the balancing leg, we want to see that the athlete demonstrates the stability required to perform the movement, while when the injured leg is the trailing leg, we want to see that the athlete is able to keep that leg. The next movement of the warm-up series will be the lunge and reach. The athlete will lunge forward and simultaneously twist their upper body towards the side of the forward leg. With this movement, we want to see that the athlete can effectively hold the lunge position, and when switching legs, see that they can drive through the front heel without experiencing any pain in the affected leg. And finally, the last movement of the warm-up series will be the side-to-side lunge. The athlete will perform a lateral lunge and sit into a deep squat position. The athlete will then transition onto the other leg while holding that squat position. In a similar vein to the lunge and reach exercise, we want to see that the athlete is able to reach and maintain the bottom squat position and effectively transition onto the other leg without pain. As we progress through our 12-week program, we should be seeing progress in the athlete's ability to move through this warm-up and hopefully return stronger than they were.
When looking at our programming, a really big goal of ours was to match each of the methods that we used throughout our program with the principles that we wanted to implement for each block. So looking at block 1, our main goal was motor control or movement competency. And our secondary goal that we would just get as a result of getting back in the weight room is hypertrophy. So in this case, we thought the 1x20 method was a really good indication for where our athlete was at now, being that she really needed to build up her tissue quality in her tendons, ligaments, and muscle tissue, while also building some capillary density and learning proper movement patterns. So our main method of progressing throughout this block is going to be through RPE. The first week, she'll start at an RPE of 5 to 6, and what that means is that after each rep, she should have about 4 to 5 reps left in the tank. As you can see at week 4, she'll end up being at RPE 8 to 9. What that means is that she'll have 2 to maybe 1 rep left in the tank. We want to make sure that we're not going past technical failure, especially because this is a return to play athlete, so we don't want these movements getting sloppy at all. And then other than that, we did decide to use 15 movements here across the entire body. Really good emphasis on the lower body as well. And then we are going to stick with the 1x20 rep scheme throughout the entire program and just progress in terms of intensity using the RPE scale. Alright, moving on to our second block, which is our foundational strength block at weeks 5 through 8. We went with a modified triphasic method, and I say modified because if you notice, we started with the isometric phase before the eccentric phase, and our reasoning behind that is actually pretty simple. Isometrics provide a pretty unique benefit in terms of building tendon integrity, and this athlete did just go through an ACL reconstruction where she had a patellar tendon graft. So in a lot of these lifts, we're going to be building strength at specific ranges of motion while also building tissue integrity within the patellar tendon, the quadriceps tendons, really all of the connective tissue around the lower and upper extremities. If you notice, we also have a lower body iso variation at the end of each session. So for example, some of our variations include a lunge with a weight vest, a weighted wall sit, knee extension on a knee extension machine at 60 degrees, and a spring ankle isometric popularized by Cal Dietz in triphasic training. These isometrics are going to progress from 3 sets of 30 seconds to 4 sets of 30 seconds throughout the block. And then at weeks 3 and 4, we'll move into our eccentric phase just because we obviously know how important the eccentric component is in any sort of deceleration activity or change of direction activity. Now, our athlete is a pitcher, but just because she's a pitcher doesn't mean that she's not going to be sprinting and running at practice and whatnot. So she does still need that ability. And that brings us to block 3, which is our last block here at 8 to 12 weeks. Our goals for this block were power and speed, so we thought the velocity-based training method was a good method to implement at this block. As you can see, we're still training 4 days a week here, but we decided to go from a full body split to an upper-lower split just because we are going to start sprinting in this block. And with the sprint work, we're going to have both an acceleration day on day 1 and a max velocity day on day 3. And you'll also note that there's both a high day and a low day, and that's primarily based off of just the demand that's placed on the central nervous system throughout the training session. So the high days are going to have pretty intense exercises, whether it be sprint work, med ball work, or lower body exercise in the weight room. And then the lower days are going to be lower intensity sprint work, 65 to 75% tempo runs. They're going to be crawl variations as well as lower intensity upper body work. From there, another thing I wanted to highlight that I just mentioned was the crawl variations that we have programmed on the low days. I think this is a really good implement for any sort of softball or baseball athlete, just because the forward crawl that we have programmed on day 2 and the lateral crawl that we have programmed on day 4, they do a really good job at working the scapular stabilizers and just improving overall shoulder health. So that's going to get really great results for our athlete as she starts to transition into her throwing program at the end of this phase. So that's going to be a really important part of this last block here, is making sure that we're integrating her with her sport-specific skill, being her pitching coach, and we're going to be in constant communication with him or her in terms of letting us know where she's at and what we might need to work on. So this is really where it starts to get fun and where she's looking forward to getting back into practice. After this block, we're going to be looking at just integrating her into her normal weight training sessions and getting ready for the upcoming season.
These are our references. Thank you for joining us for this case study presentation.